Well, if you ask me, okay, what are the strengths of the UCH Homes team? The two things I see it built on is partly on this MDT weekly, bringing all the institutions, all the different groups together, and even necessary other clinical teams in the hospital, and the care navigators, because that is absolutely amazing. I think the classic, again, I think you may have been there, but was bringing one day just, okay, we haven't got many inpatients, I'll bring you a selection. This is what the team dealt with yesterday. These are the 6 patients who turned up in A&E or whatever, and this is what happened. And as it happened, it was mostly Josie who dealt with them because of other staff not being there. And she then talked at length about 1 or 2 and some of the things that have happened, and closed with this final wonderful understatement of saying, well, there's only so much you can do. And we're all sitting there thinking, and you've gone way beyond what was normal, what would in any way be seen as normal, what you can do. You have really, and it's a very, what's interesting to me is that, well, one of the things is clearly there's a boundary issue there. How far can you go? And when do you know, when does Josie know to say, that's far enough, I'm not going any further? Because you get right into people's lives, and she's handling their benefits, she's handling all sorts of things, she's become their advocate, their friend, their supporter, and yet she's having to pull back and say, yeah, okay, goodbye, you've gone, that's it. And it's an amazing balance to achieve. And in medicine it's easy, it's one-on-one, we're behind the desk, we're the doctor, we're saying to you, we think it's this, that and the other, we might examine you, we might take a history, and we'll come to a conclusion, we'll say this is what we recommend as management. This is much more sort of hands-on involved, taking people along, and I'll take you to the housing department. Yes, I will talk to them. I will say, when they say to you, go away, say, no. And so often you can see that they wouldn't have got anywhere without her, without her doing that. And it's again, I find it is an inspired concept, and particularly the idea that they wouldn't just be based in the hospital, that they would make their own decisions about, okay, so how far outside the hospital do we go? Because I don't think there's any great handbook that says you shall go once or twice to the housing department and no more, but they seem to have got the balance right. And what's wonderful, again, is the whole idea of, well, one of the wonderful inspirations of it is that taking people who've had the experience, personal experience of it, and being able to truly say, no, I was on the street. It's the same how she was picked off with the TB. So, I did have TB, yes. I know what this is like. So, yes, I find that inspiring because again, I find it applies to patients here. I find myself thinking, yeah. And then quite a lot of patients would say, if you say to them, and I often do, what would you like to do? What did you do? And they'd say perhaps labouring or whatever, and what would you like to do? Well, and quite often I'd like to help people who've had this experience, because obviously I can. That's a difficult path to tread, not everybody can, but it's fantastic to see it worked out in someone like Josie. Yes. My last day there, when we were going to do this and couldn't, it just so happened that none of the team were there except me and a medical student. And that was fascinating, because suddenly, of course, all these things which I've said to them, fine, get on with it, There's any number of times when we've done the ward round, done anything else, and I've said, well, is there anything else you need me to do? And they said, no. So fine, only there the half day, off I go. Well, that day, it was all down to me and this medical student. And immediately we ran into things where I thought, I don't really know how to handle it as well as they do. And in retrospect, when we did I sent somebody off to housing, and it didn't really work out. And it was fine, we sorted it. But I very quickly realised, yeah, they've got more expertise in this than I've got, and they know how to do it. But I am incredibly impressed with that, with Trudy, Florence, and Josie and that team. And they've been very lucky, and I'm sure that, the key was, to my mind, the key of the success of that team must depend on the recruiting of that team, and that is key. And it's about motivating them, isn't it? It's getting the people who, oh yes, I can do this, and just, yeah. And no one would have known exactly, I think, how they'd have turned out, but they've talked about going the second mile. They are so impressive.